reminder, that last week we talked about safety and protection during COVID, and some of the key points is to remember on the left-hand column here are dwell times for your disinfectants. Okay, so you need to look at the OSHA requirements for if it says 1 minute, 30 seconds, 2 minutes. Just make sure you have your housekeeping staff and others who use the disinfectants use the time required for dwell time on surfaces. It's a little tough to do it on corrugated or soft surfaces like rugs and carpets. Those don't count, but on hard surfaces for sure. And so what I did here is I provided what the topic is for safety, and then some possible program improvement projects that you can consider. Again, this is part of my concept of copy on the fly. So if you want, you can look at these slides later. You can jot these down and include those in your copy notes as potential PIPs moving forward. I think a lot of programs have done hand hygiene. And so one of the ideas is to have teams evaluating staff, for their practices before and after, and trying to get the percent of hand hygiene done before and after a patient encounter or entering a room. So that would be some data that you can generate. The other one we talked about too is just getting staff up to steam about recognizing atypical manifestations of COVID in the older adult. And so we had that list, that in older adults, COVID tends to present as more fatigue, lethargy, loss of appetite, falls, and delirium. So there's one study that showed that 75% of all delirium presenting in emergency rooms were due to COVID-based delirium. So those are the atypical manifestations, and not only of COVID, but of influenza, respiratory syncytial virus, and any other infections. And then the other point here is that we want to make sure that people are being properly assessed for COVID screening. And that leads to checking your logs and making sure the what we call the fidelity of your logs, that you're in alignment with the current county, your own county rate of COVID and the test.
Thank you, everyone, for putting in some time to just ponder the changing institutional culture. And one easy way to step into it is to consider language. And language costs no money, and language can be changed today. In fact, in my study of the culture change movement for about 26 years now, I just was counting, the Pioneer Network, our national group, started in 1996. And I was challenged myself when I heard leaders say, you can choose what words you're going to use. And you can decide today to maybe stop using some words and start using others. And there's power in language. And so just a little bit of review here. If you look at the words we use to describe these places, when an older person perhaps has to move out of their home, where's the first place many go? What's it called? Independent living. And then they need some more assistance. And what's it called? Assisted living. And then they need more care. And what's it called? Long-term care, skilled nursing. And when someone else taught me this, she said, where did the living go? And it actually breaks my heart. And I wonder if that's part of why we have such institutional cultures that are so focused on care. And so I just want to invite every single one of you to think about that. There's power, if I could have the next slide, please, in really using words that talk about perhaps the life that people are living, even more than the care that we are giving and the care that they're receiving. And so some ways you might run into it, and I'd like to teach you, is to refer to perhaps resident-directed life or resident-directed living or person-directed life, person-directed living. And a leader in our movement many years ago pointed this out. She said, everyone, we're self-directing our lives right now, you and me. And everyone wants to do that, no matter how long they live and where they live. And so another neat way to think of it and maybe speak about it is self-directed life and self-directed living. Next slide, please. And then notice in our work here, everyone, there's a really strong definition of person-centered care that CMS put forth in 2016 with the revision of their requirements for participation. And I want to show it to you. Person-centered care means to focus on the resident as the locus of control and to support the resident in making their own choices and having control over their daily lives. And if you just keep looking at that, I'm sort of mesmerized by it. Wow, we're supposed to focus on the resident as the locus of control and support the resident in making their own choices and having control over daily life. And to be honest, in institutions, it's kind of the opposite. That's what our culture change movement points out. We have a famous quote that says, no longer are the needs of the institution going to come before the needs of the individual. And many regs are starting to point this way. And I'd love people's thoughts on this. In a way, I don't think that describes care. In a way, it describes more, right? It describes life in a way. But if our care is supposed to be totally focused on the person, we have some changes perhaps to think about. And then I like teaching you also that even though this was new and it's a good definition, when it was published, it was actually outdated. And what I mean is the culture change movement had actually been using the terminology person-directed life, self-directed living, person-directed care, and we moved to living as well, even before this. If I could have the next and perhaps last slide, please. Maybe two more. So notice person-directed care. Oh, can I go back? Care. Notice the difference also in this. We moved from person-centered to person-directed, and even for people living with dementia, it's stronger when you think of a person directing their life. It's stronger than us just centering around Joe. Hey, Joe, I know you like to golf, so I brought you some golf clubs. Let's go. And versus, hey, Joe, I heard you like to golf. Look what I have. Are you interested? And then the last slide, please. So I encourage you, I invite you all to consider maybe the challenge of dropping the view of a nursing home through the lens of our professions and our professionalism, and that it's a medical care, healthcare facility. We just challenge you to think about what words would you use if we actually realize and look through the view that people live there. It's their house and it's their home. So I encourage you to try person instead of patient, home and community, or just the name of the place instead of facility, neighborhood instead of unit or ward or station or floor, team instead of department, checking in with, it implies being equal, and check-ins equal, not even checking on instead of rounding and round. Maybe we do use approach. I love individualized approach instead of intervention. And last but not least, I learned this from coffee professionals, everyone. Some of you may know Kelly O'Neill from Minnesota. She was a leader in developing coffee. And she actually taught me that you don't have to use the word program all the time, because when we all hear the term program, we tend to check out. And what that means is, oh, the infection control program, that belongs to the infection preventionists, not me. And notice the power in dropping the word. We all need to care about infection control, period. We all should be a preventionist. Same with coffee. If we say the coffee program, a lot of people think, oh, that's the administrators. But if we just refer to our coffee processes, it implies everyone.
Right. So we're going to touch on two main points. The first main point has many points. So we're actually going to go through that a lot, but these are areas of promoting health and well-being. Number two is, there's 2 slides that's going to go through the areas of promoting. This is just going to go through the first, just a highlight. So the ones that are in bold are the ones that we're going to go more in depth on. So physical health, nutrition, we're going to go more in depth on that. Protection against infectious disease. We actually, I think last week we talked about that a little bit. Sleep, shifts and long hours, smoking, mental and behavioral health, burnout, compassion fatigue, relationships between families, communities, physicians, and other providers, administrators, staff, and other primary care workers. I mean, primary care workers out there, you probably don't think about it, but I mean, or maybe you do, but look at all those different parties that you're interacting with. I mean, that's a lot. So, and then finally, racism and social discrimination. I could have put also bullying on there. I think I did. So these are those main attributes related to, or the main areas of promoting well-being that we all at 11% meet recommended 2 to 2.5 daily portions of fruit and vegetables. We all need fruit and vegetables. Sometimes feel like we don't have time to do that, but I guess I'm here to say that these are the things that we have to make time for. If we're in primary care, it's either go insane or really focus on your nutrition and all these other things here. So 47% have no muscle strengthening exercises that's in their schedule. That's 46% in vigorous cardio exercise. And then you see the 20% there. So the point is very important that we're taking the initiative ourselves to having this nutrition as the institutions or the communities that we're involved with, they don't, sometimes they don't provide that. Next slide. All right, 37% have adequate access to employer-based exercise. So this is just what I was talking about, right? So 44% rate health as good. These are 44% of primary healthcare workers. They say their health is good, 25% very good, 5% excellent. Obviously, we really want to have the excellent on the higher number. Programs that support nutritious dieting and opportunities to learn more about what an individual's specific body, how an individual's specific body thrives. You know, like for me, salmon is great and tuna. I mean, that makes my body feel wonderful. You might not like the taste. So what is something that is, you know, useful for you? Next slide. Sleep. Report getting 7 or more hours of sleep. I was a little surprised by that, but you know, we're talking about primary healthcare workers. We're not just talking about like nurses or, you know, we're working night shift. But anyway, the National Sleep Foundation reports that 7 to 9 hours of sleep is recommended for ages 18 to shifts. We talked about this a little bit with night shifts. Is probably no surprise, but night shifts can be a challenge in regard to promoting one's health. So 4 studies found that self-reported energy levels increased with exposure to natural bright light. That's interesting. There are actual products that like have lamps that provide a natural light. And it hasn't been known to increase one's mood and et cetera. So that's something you can look into. White noise, that's a good example. Next slide, please. Mental health and well-being. So stress and burnout. If you're not familiar with stress and burnout, I'm sure you might have experienced the temptation to have this if you've had quite a rigorous schedule in primary health care. So results in medication administration, errors and poor relationships, all these different things, lower patient satisfaction. These are signs of stress and burnout, perhaps in the primary healthcare workers. Remember, primary care workers, they're like the front door. They're the first impression. They're the people that the patients interact with the most, right? So if the patients are experiencing what I just mentioned there, that is a sign that maybe some of the workers are having some stress and burnout, and probably it has been happening since there has been a pandemic. So solutions, proactivity and gaining a support system for friends, family, and coworkers. Support system, I couldn't stress enough. And it's kind of like we have a burnout a little bit, so I won't go into it too much in depth. You see here number 1, 2, and 3, when you look at burnout or see if you're experiencing it. Solutions are vacations, yay. Now you say, oh, I don't have time for a big vacation. Take a small one. There's even 5-minute vacations that you can take. So that's like related to mindfulness exercises. We're just taking 5 minutes to breathe and to be still. That's a mini vacation. Take it. Mindfulness exercises. Journaling, Can't stress it enough. So there's gratitude journals, things that you're grateful for, just reflection in general, journaling, and accomplishments, just remembering the things that has worked for some supporters, right? I'm constantly talking about this network, right? So that's very important. Next slide. All right, so compassion fatigue. I don't want to go into this too much, but these are signs of compassion fatigue. There's organizational and individual, right? This is something that so if you have experienced any of these, it's important to have a place where you can share these things, if it's with a friend or something, because if you don't, it'll definitely come out at a place and time that you didn't want. It might be in front of a patient, it might be in front of a loved one, but you will explode because you're full. We need to have a place to get these experiences out in a healthy way. Next slide, please. We all use the restroom, so that's why I love that analogy. By the way, Elsa was wrong. Okay, you should never conceal, don't feel, don't let them know. It's quite the opposite. Find a place where you can let people know what's been going on in your life. Next slide, please. Racism and discrimination. So this has actually been an issue, especially after the pandemic, but before the pandemic, it's been an issue. 80% of respondents experienced verbal abuse. Also, there's been a large percentage of physical abuse and discrimination, 40% sexual harassment. This is, of course, something that if any of these experiences are happening, you have to have community should have the proper support and persons who you can go to and talk to about that and share that, because everyone deserves to live a just life. And meeting so many different folks, as we talked about before, from many different backgrounds, especially patients, because that last slide actually talked about a large percentage of the issues that primary care workers have is from the patients. They may say derogatory things, all that kind of thing. So, but it's very important to stay objective when possible. And personal bias, we all have biases. It's very important that we take the time to not project our own biases or fears onto others. We have to know that this is how I feel because of this situation, and have a place to share that with someone. Next slide. So here's some 3 ways. You see this person looking at this painting. It's kind of the same. To be objective, you have to be able to take a step back and just think about, okay, what exactly happened here? There's a lot of great information here, but I don't have time to go through the whole thing. So let's go to the next slide. I'm going to just briefly share on holistic care. Next slide. This is a quote that I shared in the last 2 times I presented. So basically saying that you are the person that wherever you go, that's you. Okay, like wherever you are home, there's no such thing as really kind of trying to separate yourself. You are what you do outside of home affects what you do at work, and etc. What did I say, right? What you do outside of work happens to influence at home, and etc. So, all right, let's go to the next one. So holistic care, right? The treatment of the whole person, taking into account mental and social factors. Next slide. There's more information about holistic care. It's a lot in regards to social determinants of health as well. So it's an approach to healthcare that addresses the patient's needs holistically: physical, emotional, social, spiritual needs. It's comprehensive and integrated. And it's something that we need to be aware of, because it's true whether we believe it or not. I mean, these things affect our life in work and outside of work. Next slide, please. So it's not just like an Eastern practice. Holistic care involves the whole person. It really is a practice in seeing the big picture of a person's life and what they need. I mentioned social determinants of health. That'll be my next presentation, beyond the social determinants of health. Next slide. All right, so one of the things you can do is just listen. Listen, I think, is the most healing agent in the world. Any issue in life with riots and all these things started because a group didn't feel listened to. Try to listen. In order for a patient to feel valued, they need to feel heard. And I think the primary care workers need to feel heard too. So people that are over primary care workers, definitely they need to give them an opportunity to be heard. So everyone's feeling heard. Next slide. Okay, so yeah, listen more, model listening. Ask yourself, what if the resident had all the answers? This is related to that patient-centered care, right? What if that person had all the answers about their life and body? How would you approach them? What questions would you ask them? You know, like that's coming in from a perspective of, you do have the answers. Let me just help you with figuring this out. Because at the end of the day, they have to make the decision about what's going to happen with their body and their life and everything. So might as well help them with that process. That's a total patient-centered like approach, patient-directed, right? All right, next slide. Or resident-directed. All right, here's a simple quote. I won't read it, but it's very important. It'll be available for you. So, but patients need to feel respected. The primary care worker needs to feel respected. 1 to 5, how willing are you to admit when you need help in any? Strong is your network of support in fulfilling your needs. Which of these areas that we discussed do you desire to focus on? Programs or practices have you found helpful in promoting your own well-being and thriving? Because that's
Welcome back to our QAPI series, step 4, identifying your organization's guiding principles. Again, I am with Mountain Pacific Quality Health. My name is Crystal Morse, and I also invited Natalie Correll. She's the administrator at Westward Heights Care Center. We're not only tying in the wellness component to our QAPI series today, but also how you can move, get your QAPI program takeaways from last week's session. So have any of you conducted a QAPI self-assessment for your nursing home? If we could hear from you in chat, that would be wonderful. And if you have, if so, what did you identify as an area to focus on? Or what about Natalie? I guess I'll call on you since you're my wingman here. Have you guys done have you done your QAPI assessment for this year?
Yes, we have. And we are, Kathy, I think, is also on the line. And so Tia, they can chime in. We are working. We have some high area of focus for UTIs, especially focused in one hallway. We have started a fall PIP. I think a lot of people can understand the falls in and out of quarantine, isolation, things last year, but just looking deeper into that with a heavy focus on pain. So those are 2 main focuses for us right now.
Statement for QAPI should include, and this is a single choice, so corporate compliance, improvements that will support the vision and mission, fiduciary responsibilities, team member roles and responsibilities. I'll give you 20 seconds or so to answer that. Again, a purpose statement for QAPI should include, single choice only, corporate compliance, improvements that will support the vision and mission, fiduciary responsibilities, team members' role. And Natalie, while they're typing in, what is your mission statement?
Dignity in life.
Simple, easy, describes the purpose and guides the actions in your homes. So the mission should also serve as the foundation to help guide decision-making, setting direction, and engaging the care team towards a common goal. A strong mission statement inspires engagements and helps boost performance with notable outcomes. Mission statements should always be easily viewable by your team, the caregivers that work there with you, and the visitors who you welcome into your homes. So again, everybody should know your mission and they should be able to recite it from the top of your head. So just like Natalie did, something short, concise, and easy to remember. It's also helpful to recite your mission often. So for example, when you're in your daily huddles, that should start off your day, almost like a daily prayer. That mission statement, you should repeat every morning so everybody knows it. It's a foundation in their head and it drives them. Okay. Staff meetings is another good place to do so. Next slide, please. So a mission and statements go hand in hand. A vision statement is a picture of your homes in the future. It's an inspiration and it's a framework of your strategic planning within your homes. So the next steps are to develop a purpose statement that describes how QAPI will support the overall vision and mission of in your building. So again, for example, you want your purpose statement, you want it nicely laid out, but take bits and pieces of your mission statement and your vision statement and put it in your purpose statement for your QAPI. You have your QAPI statement. If we have time, we can come back and practice that. Next slide, please. So here's a trivia question for you all. What does the industry of aviation? Both are all about safety of their consumers and continual improvements to processes. So you think about it, right? The airlines, aviation, flying, they have got to triple and double check safety, safety, safety. They've got lives, they've got people's lives in their hands every single day. Same with the healthcare industry. And there's nothing wrong with an old-fashioned checklist, okay? So I've got an example here that you can use in your QAPI. And again, it talks about who's responsible, whose role it's going to be, what's the purpose, establishing your guiding principles. So again, this is a nice checklist that you can use in your homes to keep everybody on task and on target. And again, around patient safety.
Crystal, I just have to jump in for a minute. My favorite thing that I've ever heard about checklists is it's for new people not to forget, or to help new people to remember, and seasoned people not to forget. And their example is, do you want your airline pilot to not follow the checklist? You know, so I think
exactly
they work for everything. Yeah.
Yep. No matter how, if you're new or if you have been there a long time, there's something called workarounds, and that's not a good thing. And so when you get to be more seasoned in your, you get more practiced up and you think you know what you're doing, there's more workarounds, and that's not always safe. So checklists, checklists, checklists. Okay. And again, good old fashioned checklists. Next slide, please. All right, so here is a CMS Copy Worksheet that I am providing you all. So it's intended to help your teams establish appropriate goals for individual measures and for performance improvement projects. So here it talks about the SMART goals and how you can define those, how you can work on a PIP, so a performance improvement project. So, you need to develop your SMART improvement goals. So these are effective goals that are specific, and actually we will go on that on the next slide for that. But things to remember are, as you work on your quality improvements, answer these questions. What are you trying to accomplish? How will you know that the change is an improvement? And what changes can you make that will result in the improvement? So have you all heard of the SMART goals? And if so, have you used them? And while you take a minute to, and I'll look at the chat, but while you take a minute, yes. So Judy's saying yes, she's heard of them. So can anyone tell me what, or actually it's on the slide. So specific, so the goals are in terms of the 3 W's. So that's on the worksheet that I hope one of my colleagues put the link to that worksheet in there. So again, it talks about the 3 W's under specific. Who will be involved? what you want to accomplish, and where will it take place. So it's got to be measurable. So you got to start small if you want to, but you've got to determine, is the goal that you've set, is it reachable? So determine what measure you'll use, get a baseline, and what you do to increase the numbers to, okay? So again, get a baseline. How will you increase your numbers and get to where you want to be? Is it attainable? So defend the rationale for the setting of the goal measure. This will help determine the goal that is set, if it's too high, if it's too low, or if it's reasonable, okay? If it's relevant. So briefly describe the goal and how it will address your problem statement. And then time bound, what is your time frame? And so now so before we practice a problem statement, just be sure that you're using the formula, do it in order. The goals need to be comprehensive, concise. It should be able to articulate it, that the whole team can understand it. And again, get buy-in from the team and their offerings that they have to suggest when you're writing your SMART goals. So Natalie, this is where I'm going to call on you. So this is where we talked about the vaccination rates, and this was last year. This was before nursing homes mandated the vaccine. And so you were one of the first to, your vaccinations were just, you were with everybody else, you had low numbers, you went from low to high numbers in your vaccination rates. And so can we practice with this SMART statement? So just take us through this. So your goal was to increase your COVID vaccinations by, what was your percentage?
Well, 100% of staff that didn't have an exemption. So
Okay.
I don't know that, I mean, I think we were saying 100% at first, but we didn't know how many exemptions would come through.
Okay. So who was your team? Who was your team makeup?
The entire team at Westward Heights. So we had 110 employees, 115.
Okay. So it says here so who was responsible to accomplish the goal?
It was me, our infection control staff development nurse, Kathy, our nursing leadership, and our human resources.
Okay.
We were the team that worked on it, presented it.
Okay. And then it says, we'll accomplish this goal by, what was your date? What was your target date?
November 1.
November 1st. So you started it when?
August 8th.
And what would you say your baseline was?
We were at the high 50s, 59 or 60.
Okay. So basically, your goal was to increase your COVID vaccination rates to 100%. You listed your copy team and who was all going to be involved. You'll accomplish this goal by, what did you say again? November what?
November 1st to be fully vaccinated. So depending
Okay.
on which series you took, you had different dates, but November 1 had to be the plus 14 days.
Okay, wonderful. All right, thank you, Natalie. So your interventions, again, I think it's before Natalie, I let you talk on some of your interventions. Instead of exit interviews, do you all conduct stay interviews? I'd love to know that, because by the time they're exiting, it's too late to save them. So again, stay interviews is what we call them, or if you call them something different, I'd love to hear about it. Surveying your staff. I saw that you all did that, Natalie. So can you talk about some of your interventions and how you got your COVID vaccination numbers up? What did you do?
So I think we started with our mission. We met in small groups with every team member over 2 days. And we just spoke about why we would be doing this, and that our mission's dignity in life, and our values are quality of care and quality of life. And we did not feel like that was happening. We had been locked down for most of July from team members, getting exposed, being positive, and then 2 weeks we would go. And we decided that if safety's first and our residents are first and they're the center of what we do, that we were going to make a choice to make them as safe as possible. And I say that with the science and the information that we had at the time.
Yep.
And so that's how it started.
So you brought in education on the science, the safety, what were their questions? What were their hesitations? I also
offered them special meetings, with the people they felt comfortable with, because a lot of it is about that relationship.